We discuss superficial and deep perineal pouches as well as vaginal and rectal examination. So the competency is about superficial and deep perineal pouch, boundaries and contents. First we'll start with the superficial perineal pouch, boundaries and contents. Superficial perineal pouch, it is the space between deep membranous layer of superficial fascia and the perineal membrane. Its boundaries are inferiorly the membranous layer of superficial fascia. Superiorly it is the perineal membrane and laterally by the ischiopubic rami. Contents of the female that includes the clitoris and the crus, bulb of the vestibule and the greater vestibular gland. And three muscles, that is ischiocavernous, bulbospongius and transverse perineus superficialis. Contents of the female include the vessels and nerves, that is two posterior labial vessels and nerve, transverse perineal vessels, perineal branch of posterior femoral cutaneous nerve. Other structures passing through the pouch are the urethra and the vagina. Contents of the male: root of penis, the bulb, right and left crura. Muscles include bulbospongius, ischiocavernous and superficial transverse perineal muscle. Nerves include branches from perineal nerve, which include the posterior scrotal, nerve to bulb, muscular long perineal nerve from posterior cutaneous nerve of thigh. Vessels include branches of the perineal artery, namely the posterior scrotal and transverse perineal. Branches of the artery of penis, namely the artery to bulb, urethral artery and deep and dorsal artery of penis. Deep perineal pouch, boundaries and contents. Deep perineal pouch boundaries. It is the space between deep to perineal membrane. It is completely closed. Its boundaries are inferiorly the perineal membrane. Superiorly it is the superior fascia of the urogenital diaphragm. Laterally the inferior portion of obturator internus fascia. Contents: in female, urethra, external urethral sphincter, deep transverse perineal muscle and vagina. The vessels are dorsal artery and vein of clitoris, deep artery and vein of clitoris, artery to the bulb of vestibule and dorsal nerve of clitoris. Then structures palpable during vaginal and rectal examination. Procedure of structures palpable during vaginal examination and the procedure before examination. Procedure before examination. First, obtain her verbal consent. Explain that you are about to perform an internal examination of vagina and uterus using fingers. Explain to her that it should not be painful. Ask her to empty the bladder. Assure privacy and ask for a chaperone. Then draw the curtains. Ask her to lie on the couch and undress, waist down. Cover a sheet for her dignity. Position her on the back, hips and knees flexed, thighs abducted. Examine abdomen for any mass and be sure bladder is empty. Inspect external genitalia for any warts, rashes, ulcers, lumps, vesicles and excoriation. Lubricate the right index and middle finger. Expose the introitus by separating the labia with thumb and forefinger of the gloved left hand. Gently introduce the gloved lubricated right index and middle fingers into vagina. Thumb abducted to allow the maximum use of the length of the index and middle fingers. Ring and little fingers flexed into the palm. Ask the patient to cough to test urinary incontinence. Ask the patient to bear down to test uterine prolapse. Palpate the vaginal walls as fingers are introduced for any mass, cyst or foreign bodies. The vaginal walls are rugose and moist. Palpate anterior, posterior and lateral walls of vagina and fornices for any obliteration or bulging due to pelvic swelling. Examine the cervix. Locate the cervix with pulp of the fingers. Normally it points downwards and slightly backwards. The cervix is firm, rounded and smooth. Assess the mobility by moving the cervix gently. Palpate the fornices. This procedure is painless. Any tenderness is called cervical excitation. Bimanual examination. Place the palmar surface of the free hand on the anterior abdominal wall, 4 cm above the pubic symphysis. Attempt to capture the uterus between the opposing fingers. Use inner fingers to elevate the cervix and uterus in direction of the external hand while simultaneously pressing the external hand in the direction of the internal fingers. Bimanual examination. In bimanual examination, palpate the adnexa. It is difficult to palpate in obese women. Place the fingers of the free hand on the iliac fossa while readjusting the vaginal fingers into the lateral fornix. Feel the adnexal structures as they slip between the fingers. Bimanual examination should not be painful. Palpation of ovaries may elicit discomfort. If any adnexal structure is felt, assess size, shape, mobility and tenderness. Ovaries are firm, wide, ovoid and often palpable. Normally fallopian tubes are not palpable. Withdraw the fingers. Consider rectal examination. Rectovaginal examination is sometimes better for palpating ovaries. Give a towel or a tissue to wipe herself. Replace the sheet and leave to dress. Explain the findings once dressed. Rectal examination. The rectum is a curved lower terminal segment of the large bowel. It is about 12 centimeters long and runs along the concavity of the sacrum. Anterior to the lower 1/3 of the rectum lie different structures in men and women. Structures palpable during rectal examination. In men, anterior to the lower 1/3 lie prostate, bladder base and seminal vesicles. In women, anterior to lower 1/3 of the rectum lies the vagina. This is an intimate and sometimes uncomfortable examination. It is most often done when disease, usually gastrointestinal, genitourinary disease, is suspected or already identified. It may also be done as a part of screening examination. It is important in all cases to explain the reasons for the examination and get verbal consent. Indications for rectal examination are assessment of the prostate, particularly symptoms of outflow obstruction. When there has been rectal bleeding prior to proctoscopy, sigmoidoscopy and colonoscopy, constipation, change of bowel habit, problems with urinary and fecal continence, in exceptional circumstances to detect uterus and cervix when vaginal examination is not possible. The fingers is moved 360 degrees, feeling the walls of the rectum. When with the finger, the anterior wall can be palpated. In men, the prostate is felt anteriorly. In women, the cervix and retroverted uterus may be felt with the tip of the finger. Examination of prostate. Its normal size is 3.5 centimeters wide, protruding about 1 centimeters into the lumen of the rectum. It is normally rubbery and firm with smooth surface and a palpable sulcus between the right and left lobes. There should not be any tenderness and there should not be any nodularity. Examination inspection done for in skin disease like skin tags, genital warts, anal fissures, anal fistula, external hemorrhoids and rectal prolapse. Skin discoloration as in Crohn's disease and external thrombosed piles. Internal examination is done for simple piles but best examined at proctoscopy. rectal carcinoma, rectal polyps, tenderness, diseases of the prostate gland, and malignant or inflammatory conditions of the peritoneum felt anteriorly. These are the structures palpable during rectal examination. Thank you.